Welcome to the Integrated Cancer Center of the Montérégie area. We are located in front of the Charlemagne Hospital. The CICM is part of the Centre intégré de santé et services sociaux de la Montérégie-Centre. When you arrive for your first appointment, report to the radiation oncology department on the main floor. The secretary will attach to the back of your blue hospital card a personal barcode. You will use this barcode to check in when you come for your appointments. It is important to have your hospital card with you at all times. In the consultation room, you will meet with the nurse. Together, you will fill out a questionnaire. The nurse will explain to you the recommendations and procedures for the treatments. Then, the radiation oncologist will discuss the details of the radiotherapy and the side effects that may come from the treatment. Please do not hesitate to ask any questions. Radiation therapy is a local treatment that aims to eradicate malignant cells while limiting the dose to the surrounding normal tissues. After these meetings, the next step is to plan for the treatments. This step is divided in multiple phases. Should radiation therapy be prescribed, the first phase will be for the positioning of the treatment. You will begin by going to the mold room. The position of the treatment is determined, and all the immobilization accessories are made there. These accessories are used to ensure a stable position that will be used every day. You must be comfortable in this position since these accessories are used for all the next steps in the planning of the treatment. If you feel any discomfort at this point, it is important to mention it immediately to the technologist so that it can be remedied. After this step, it will be impossible to change or alter your position. Some treatments may require that your bladder be full. The therapist will give you information about water recommendations. The CT simulation is the second phase. It is performed in the treatment position and is done for the purpose of calculating the radiation dose. An intravenous contrast product may be necessary. At the radiation oncologist's request, a magnetic resonance imaging, or MRI, may be necessary. At the end of the examination, 4 to 8 tattoos, smaller than a freckle, will be made on your skin. They are essential so that the technologist can reproduce your position during the treatments. The next phase is the dosimetry. The dosimetry is the longest step and your presence is not required. Using the images taken from the CT sim and the MRI, the radiation oncologist and I will decide on the exact location where the treatment must be given, as well as the organs that must be protected from the radiation. At this point, we will determine the dose and the appropriate fractions to give you. In short, the goal of this plan is to find the best treatment designed specifically for you. Our highly qualified physics department will perform quality control checks on both the machines and your treatment plan to be sure that everything is in order and ready for you to receive your treatment safely. When the plan is ready, you will be called and given your start date. Please note that the delays between the scan and the treatment can take up to 2 weeks. When you arrive to the lower level, scan your blue hospital card and have a seat in our waiting room. One of our technologists will come and greet you and go over the procedure. There are 2 types of radiation machines in our department: tomotherapy and linear accelerators. Each one delivers radiation, but they do it slightly differently. The one to which you will be assigned depends on the requirements of your plan. During the treatments, the technologist must leave the room. The treatment bunkers are built with an intercom system and cameras that keep you in contact at all times with your technologists. If necessary, the radiation machine can be stopped during the treatment. We place the patient in the same position as the planning stage. With the help of their tattoos and the lasers in the room, we can reproduce the exact position with the highest level of precision. The patient must stay still during the entire period they are lying on the table. They must breathe normally and regularly, stay calm, and relax. After your radiation treatment, you are not radioactive. You can therefore continue your daily routine and activities. Please follow the recommendations given to you by your doctor for skin care and exercise. As a family caregiver, you can help accomplish certain tasks with a patient. You will meet with your radiation oncologist once a week or every 2 weeks on a fixed day assigned by your care team. We have many professionals ready to help you throughout the course of your treatments. The CICM provides information sessions and support groups which are available to patients and their families.